Now that you know about what happens during sexual arousal and also during orgasm, we'll touch upon a little bit about problems or sexual dysfunctions, and they are called as female sexual dysfunctions. Typically, they are in 4 different categories. Women who have problems with desire or not having the desire to be sexual, problems with arousal, and then problems with reaching climax. Finally, there are sexual pain disorders. Now, these are not separate conditions. There is a link between all of them. So, let's say a woman who has been married for about 2 years, she grew up with the notion that sexual intercourse would be a very painful act. And when she experiences that kind of a pain, there is a condition called vaginismus. We will talk about that separately. She is likely to lose the arousal, not get sufficient lubrication because she is anticipating pain. And if this cycle happens a few times, she ends up losing the desire to be sexual with her partner. I would like to emphasize that these are not discrete or separate categories. There is an overlap, and I'll use a case example here. Let's say there is a couple who've been married for about 2 years. The woman in this couple grew up with the notion that sexual activity is painful, especially intercourse is painful. And if they have tried a few times and it was indeed painful for her, the stage before that is arousal. So in time, she also begins to suffer with problems with getting aroused. And when they keep trying and when the end result is not something that is pleasant for her, in time she is likely to lose the desire to be sexual. So, sexual pain disorder can also affect sexual desire. Looking at them individually, yes, women do have differing desires within their menstrual cycle. So, there is a connection between the hormone levels and sexual desire. Women are likely to have more desire at the time of ovulation, which is the mid-cycle. Desire again is not something that happens in isolation. There are medical conditions such as diabetes or thyroid problems. There are psychological problems which affect desire. So a lady who has depression, let's say, is likely to suffer from low desire. There are other medical conditions like pain disorders or diabetes which affect desire. Relationship problems is a big one. So good relationship and good sexual relationship always go hand in hand. So if a couple is having a lot of relationship issues, that also affects the woman's sexual desire. So there are multiple factors which affect her desire.